For years, people have been concerned about Ontario's healthcare system. Here in our area, we've experienced closures and staff shortages, among other issues. And now a new report today is making particular note of the critical situation in the Hamilton, Halton and Niagara area. Laverne McGee joins us now with those details. Laverne.
The report by the Ontario Health Coalition is alarming. It tracks the closures of urgent care centres and hospitals and found the numbers are higher than ever. They say the province's healthcare system has collapsed and they're demanding the Ford government fix it.
We have broken the all-time record for emergency department closures.
A new report includes our area in determining that a critical situation is imminent if the problem is not addressed right away. The Ontario Health Coalition represents more than 500 organizations made up of healthcare providers. This morning, their executive director released the report at Queen's Park and noted that the Hamilton area was of particular concern.
One would think that we would be seeing serious action to address these because they are the most urgent services and people's lives depend on them, but that's not what we're seeing.
The report reveals that in the province of Ontario, there's been 1,199 closures of vital hospital services this year. 868 temporary or permanent emergency department closures, and 316 urgent care center closures. In our area, the Fort Erie and Port Colborne urgent care centers are now closed overnight. On July 14th, Hamilton General was forced to close 1/3 of its level 3 ICU beds due to lack of critical care nurses.
The immediate cause of the closures is, of course, the staffing crisis. It's a lack of nurse staffing, in some places a lack of physician staffing, and others health professionals. The government is fighting in court to bring back Bill 124 and wage suppression legislation again, inexplicable in a state in which we are having emergency departments and birthing closed, across the province in our local hospitals.
Ontario's official opposition NDP leader Marit Stiles is calling for action.
The Ford Conservative government just doesn't seem to care. They have seen our healthcare system as just another way to help their insider friends make a buck. And while they're funneling those public dollars into private pockets, we cannot go back to a government that lays off nurses and slashes hospital budgets in this province.
We asked for a response from the Premier, and we were sent this statement that reads in part, "Our government is proud to have one of the largest publicly funded healthcare systems in the world, a system we've invested over $80 billion this year, which includes a 4% increase to the hospital sector. Investing $44 million to help emergency departments stay open, this investment includes smaller and rural hospitals for the first time."
The Ontario Health Coalition also estimates that over 30,000 hours of health care have been lost due to these closures, which may have cost people their lives. In the studio, Laverne McGee, CHCH News. Back to you.